Hello everyone, welcome back. I'm Dr. Sherman Knapp, this is Dr. Deborah Knapp, and this is Egrid. We're with the Veterinary Orthopedic and Sports Medicine Group. We're going to be doing the Knapp Sports Medicine at-home assessment now of the hind limb and also of the spine. And please feel free to refer to the forelimb for additional information as we go through this. So when I'm doing my hind limb assessments, again, it's okay if you start at the top and work your way down, or start at the toes and work your way up. Just try to be systematic, and I like to always compare the left side to the right side, okay, so you can feel for symmetry. So with Egrid, what we're going to do is I usually start at the toes, and this is exactly how we do our orthopedic and sports medicine assessments at VOSM. So what we're going to do first is just look at the nails, just like we mentioned for the forelimb. You can tell so much from those. If there's a neurological condition, they may be scuffing and the nails may be shorter. If there's a lameness, they may not be using the limb as well, the nails may be longer. So always compare left to right. When you actually look at the pads or the digits underneath, remember, if you're outside hiking, running, doing any sports, they can get little grass-ons, little pebbles, sticks that get up inside there. Imagine if you're out hiking and they're in your shoe, pretty uncomfortable, so look for those as well. And also look at the pads to make sure there's no abrasions, no lacerations or foreign bodies that you can see there. So you can do these evaluations standing, or you can do them laying on the side, whatever your dog's most comfortable with. I like, again, with Egrid or my patients at VOSM, to be standing if at all possible so I can feel for symmetry. So we'll lift the limb off the ground. Always support this structure above, or the area of the limb above, and that gives you a better chance to look at what you're looking at here, which will be starting with the nails. And in Egrid's case, they look really good. We get to the pads. They're very soft. You should be able to squish these, no sensitivity, no signs of pain, no irregularities, lumps or bumps on them. These little digits right here are just like our fingers, if you would. So it's not uncommon. If we do this, we may crack our knuckles. So a little snap, crackle, pop in the digits is okay as you're manipulating, as long as it's not painful. If it's painful, please stop. Mark that in the record so you can go ahead and use that when you go in for your next assessment with your healthcare professional. So now as we go through the digits, each one of these, just like our fingers, has 3 segments. We're going to put them through range of motion. Make sure they glide very nicely. We work our way up to the larger pad. It feels soft. There's a nice motion to that. We can work our way all the way up. This is what we call the metatarsal region, essentially our foot, and we get to our heel bone. Okay, and so right here at our heel bone, this is our Achilles tendon, okay? And so certain breeds of dogs, we definitely see them predisposed, genetically even, to having issues with their Achilles tendon. If you run a lot, do a lot of hiking, or your dog does a sport, definitely pay attention to those as well. This is a place I think it's really helpful to have them stand and just run your fingers down there at the same time, just to make sure that you feel like there's symmetry. If one seems abnormal, again, mark it down in your record. Also take a picture of that, okay? And as you're doing these range of motions, get a video as well. So this is, again, our heel bone in a person, or the calcaneus in a dog. So when we go to put what we call the hock, or our ankle, through range of motion, you can lift the whole limb off the ground and actually just do a nice flexion extension, okay? It should glide, no snap, crackle, pop, no signs of pain or discomfort, okay? Working our way back to the Achilles tendon, we can feel all the way up, and now we're getting to what's called the stifle, or our knee. Please pay attention to this. So just like in the forelimb, elbows, elbow dysplasia, elbow arthritis, the most common cause of forelimb lameness in most companion dogs. Shoulders, the most common cause of forelimb conditions or performance-related issues in performance dogs. In the knee, in general, worldwide, the most common cause of injury in dogs, okay? And people, we call it an ACL, and dogs, we call it a CCL. So what I want you to do here is just kind of gently put your hands on the knee, or what we call the stifle, kind of cup in front. You can feel behind. Feel both sides at the same time. Is there heat on one side more than the other? Is there swelling? Does it seem like there's any kind of thickness there? Again, if there is, jot it down and take a picture. When we do range of motion of the knee, again, this is our knee, this would be our hip, this is our ankle or our hock. We can go ahead, place your hand in front. The other hand comes down here at what we call the foot area, or the tarsus, and we can just lift off the ground, and we should be able to go up, and look at that. Beautiful flexion of the stifle, okay? We can put through nice range of motion, okay? It glides smoothly, no signs of pain or discomfort. If all of a sudden you're doing that and they start to really resist you, please don't force it, don't push it. Mark it in your records. But I want you, as you're doing the range of motion, also have somebody get a nice picture of that, or get a nice video so it shows what the normal range of motion was at that particular time. So in the future, if you say, you know what, something does seem off in the stifle or the knee, you can pull out the video or the picture to compare. Again, if there's something you don't like or it seems abnormal, jot it in the notes. When you go in for your consultation, take that with you, the notes and the pictures of the video. We work our way up from what we call the knee up to this is the femur. Egret has incredible hamstrings and incredible quads. You can see that. Feel both at the same time. Make sure there's nice symmetry. They should be soft. You should be able to glide these back and forth. No lumps or bumps, no trigger points. I'm just gently pressing on these. And we get to the area of the hip. Okay, and so hips in dogs, again, they can get genetically hip dysplasia. We see that not uncommonly. You can get hip arthritis as well. Let's do some gentle range of motions of the hip. So to do this, I find it the easiest to go ahead and just gently put your hand in front, okay, to add some support. Now what we'll do is bring your hand in front of the knee or the stifle, and I kind of use my body to just add a little bit of extra support because they're going to be on 3 legs and you want to, balance them. And then I'm just going to bring this up into a nice extension, okay, and just hold like that. And so if they sometimes pull back or resist, don't force it. But sometimes it's just that they're saying, what are you doing? I'm not too happy about this. So sometimes offer a treat, kind of get them not thinking about it, and then all of a sudden, you might be able to gain, there's our extension. Okay, nice range of motion and extension, no pain, no sensitivity. Now how about what we call hip flexion? So for this as well, you can stabilize them at the hip. You can come up in front of the portion of the stifle, just gently lift that off the ground, and look at that flexion. Okay, beautiful flexion. That's what we should see in a normal dog. So I really like the hip flexion, the hip extension. The last thing we'll do in the hip is the psoas. Without a doubt, performance dogs, active dogs, just like in people, if you're a runner, if you're a cyclist, psoas, or what we call groin pulls, groin strains, so common. Same with these guys. Just because we feel tightness in a psoas doesn't mean that there's pathology or something abnormal, but if you feel some tightness during the stretch or the area when we palpate, just jot it down. Okay, so how do we feel for the psoas or the groin in a dog? Very similar to a person. So this is their spine. This is what we call the flank area. This is the hip. So the psoas runs from right up here under the ribs and the spine, comes all the way down and goes to the inside of the back leg. It's a hip flexor. So its job is to do what? Just like in people, bring the leg off the ground and flex the hip. So to test it, we have a couple of different ways we can do that. The first is the stretch. Very simply, give some support to the lower body. Bring this leg up into a nice extension, and then as you do that, you can just gently bring the leg out to the side a little bit, okay? And so again, there shouldn't be any resistance, they shouldn't be fighting you, should be a nice, what we call iliopsoas stretch. The next thing you can do is just gently put your fingers along the area of the flank and just kind of massage it, okay? Do you feel any tension? Is there any spasm or trigger points? It should glide very smoothly. And the last test we do, we call it the bounce test, and all we're simply doing is gently coming into the area of the flank, in front of the hips here, and just gently lift up, okay? You should be able to literally lift their paws slightly off the ground. You're feeling for, does an area get tight? Do you feel spasm or resistance? Or do they actually turn to the side and say, whoa, what are you doing? If you see that, jot it down in the records, get a video, get a picture, and make sure you make a note of that for when you go for your next evaluation.